Thanks so much. It is really my pleasure to be here, and I really appreciate the invitation. We have very much appreciated being a partner of the American Psychological Association with you folks, and are just really excited to be able to work together. I'm excited to be able to share the trends and themes that we're really seeing emerging in mental health, and being able to. What I'm really hoping is that you folks will have an active conversation in the chat here as the presentation's going along, and we'll be happy to try to answer any questions during the presentation and afterwards. So again, thanks so much. Well, let me go ahead and get going. So again, we're going to talk about emerging trends in mental health today. Now, because I'm a licensed psychologist, I'm very much paying attention to relationships, and so I wanted to do a little bit of a personal introduction here before we got started, just so you had a sense about who I am. Sometimes, I don't know about you, when you go to these kind of corporate talks, it just feels like somebody jumps right into the content. So I thought I'd give you an introduction for a minute. You can see this is my family. My wife Julie and I have been married for over 20 years. That's very hard to believe. But time flies, and these are our 5 kids. All 5 of our kiddos are adopted, and they range in age now from 13 going on 25. Anybody else raise your hand who feels like that with your kids? All the way down now to 8. So they're actually doing really well. We've been doing virtual school for a little while, like I suspect a number of you have been, and everyone's doing great and healthy, thank goodness. And for those of you who have pets, we actually have 3 dogs. This is just a picture of our big dog. This is Watson. He's a Great Dane. He's about 140 pounds. So thank goodness we actually, when I took this job at the APA 3 years ago, we actually moved out into the country a little bit in Northern Virginia, because he needs a big yard to run in. But it's been great with the kids. So let me start the talk. One of the things that's really important, especially in this day and age, I want to start out by pointing out a couple of elephants in the room. And even if we wallpaper the elephant, I think it's really important to point out some of the things going on in today's society and the way people are living. And frankly, that's one of the things I want to highlight for our talk today. Also, is that I'm going to highlight some data and some analytics and some things I think are important about mental health trends. I also want to talk about some things that are really going to be issues for our country and for society, things that people are talking about at the dinner table. And I hope you're okay. I want to be brave enough to talk about some of the hard stuff too. And so that's where we start with the wallpapered elephant here. That is not, by the way, our other pet or our dog, of course, haha. Now, this is not going to surprise anybody, but one of the things we really want to talk about is just how very difficult this last year has been for so many of us. Many of you have probably heard this term VUCA. It refers to the conditions of your business or the environment being volatile, uncertain, complex, and ambiguous. Just using regular language, it just means things feel like they're a hot mess, and it's really hard to predict what's going to happen next, whether or not you can develop strategies that in fact are going to meet the needs, or whether your strategies, whether it's so hard to sort out that the strategies you develop in fact won't meet the needs because things change so quickly. It's just very tough. And in fact, that's where I'd really like to start, is just by identifying how difficult this last year has been for all of us. In fact, what I'd like to take a second to do is just ask you, in the midst of this volatility and complexity of the last year, and just ask you to reflect on the last year and how that's been for you. I want you to think about in your own life what some of the themes that might have emerged. Thinking about the personal side of life, the mental health side of life, your family and community, and ask you just to think, what have you learned in the last year? What themes have really emerged for you, and what does that mean? Now, one thing I want to highlight for just a minute as a way to talk about the world is the power of relationships. I think a lot of us have really recognized that in the past, we took a lot of the way that life worked for granted. On my part, I work in Washington, D.C. We moved out to the country, and so I had this very long commute to get into work. I did work on the train like a lot of us do, but I was able to go in and I was able to see the people I cared about, see my coworkers, have this interesting kind of like break and transition between work and home life. I was able to go visit relatives. My wife and I, we have a pretty big extended family. We saw them regularly. And so much of that changed in the last year. And so that really comes up for me, and I suspect for a lot of you. We've all experienced a very significant amount of anxiety and grief and loss this past year. A lot of us have lost jobs. We've lost those connections with other people and those daily routines. I was just giving you one example. One other thing that comes up for me is just the routine around eating, having to take time to stop and have lunch and block that in your calendar. If you're working out of your home, that's just so much more difficult. I don't know about you, but I'm tired of making myself hot dogs for lunch before I could go get a salad. You have to really put more effort into it when you're at home. Frankly, even on a much more serious side, the feelings of safety have changed too. Just on a personal note, there's a lot of health anxiety, very significant health anxiety. And as a last point, there's a significant amount of grief and loss, not just health anxiety and anxiety in general, but grief and loss. And on a personal note, I lost my father to COVID last year, and I know so many of us have lost loved ones, coworkers. On the clinical side, we've lost patients, and it's just been very, very tough. And so that's one of the, as part of looking at this VUCA world, so many of these personal details, personal things in life that I think we probably took for granted, just really come up to the surface for me. And so I wanted to start this by just saying how much we need to be in this together. I wanted to say that it's okay and maybe even important to stop, to really reflect on how much has changed in the world and how it's affected all of us, and what does that really mean for our lives. And so I would ask you to think about that in your own life, just like I've reflected a little bit on mine. Now, the hard part of this is that in the midst of all the change, the anxiety, the relationships, the pieces we've taken for granted, some days it just feels like we're working against ourselves. It feels like we're trying to get everybody to row in one direction, and goodness gracious, if it doesn't seem like the person either you're working with or your family, the nation's politics, et cetera, it just feels like it's hard to get anywhere. And that's part of the elephant in the room that I wanted to say, is that so many people, when you talk to them and ask them how they're doing, they might give you a response and say, I'm doing okay, or I'm fine. But in reality, so many of us have struggled with mental health issues. And I don't necessarily mean like a severe mental illness where we're just debilitated, but just the personal side of life and how you feel about life and your relationships. It just feels like it's hard to kind of move forward. And it's important to recognize that. And it's important to recognize that so much of the world has changed, and we all feel, many of us feel like we have been thrust into the change. The change has been in some ways forced upon us. If your business is like mine, you want to be very thoughtful and preparatory about what change looks like. Think about the consequences and try to anticipate any maybe unintended consequences. This last year has just been really an upheaval and such urgent change that it's just forced us all, frankly, in some ways that have been really positive, but it's really been just a year of significant change, both in the mental health workspace, as well as just the mental health of our country and how we think about ourselves and our lives. Now, this might be a little bit idealistic, maybe even a little cheesy, but I hope that you'll appreciate the intention here, which is what we really want to do is think about how to turn this VUCA kind of environment into something a little more positive. And so I want to talk about that today. I want to talk about the trends in mental health and how those can help you lean into the new normal, the new way that we're doing work. So trying to think about instead of a volatile set of conditions, how can we turn that into having a real vision for the future, a clarity about vision, so that it moves from uncertainty into more understanding. How do we move from a complex set of conditions into developing clarity? And lastly, moving from ambiguity to agility. Ultimately, what we're talking about is we're talking about trying to find ways to turn up value for our customers from a business perspective. And I know, like you, I have been in one too many talks over the last year while dealing with personal and professional challenges, talking about all the business pieces. So on the personal side, maybe we should, rather than talking about value for customers, really what we want to do is we want to think about how can we all move forward to have impact, how to have impact to improve the health of our families, ourselves. How do we improve the health of all of the communities that we serve and work with, so that really we want to work together and move forward, so that we're not actually rowing against each other, but in an ideal way, we can really work together. Now, the way I want to talk about the trends is, I don't know about you, but when I was watching the news, I noticed that CNN had put out this new special recently about like the history of late night. And when I was younger, I can't stay up that late these days, but when I was younger, I used to love watching David Letterman. I thought he was hilarious. And so for anybody who's a David Letterman fan, and even if you're not, I'm actually going to go through this in kind of a top 10 list sort of format. So we're going to spend a good bit of time on each one of these sections, but I'm going to go through 10 of them. And I hope that these are helpful to you as you really think about when you're working with your customers and with your partners. What are the things that they're thinking about? What are the issues, not just in terms of data and information, but what are the issues that their executives, their employees, what are they thinking about when they go home at night? Whether they still have a commute by train or car, or whether they just walk from their, like I'm doing right now, walk from their office into the dining room. What are they thinking about? What really matters to them specifically about mental health? And so that's what we want to focus on. So we're going to do the top 10 list. And just like David Letterman, we're going to start with number 10. So let's start with number 10. Number 10, and there really isn't a, I don't have a drum set, so there really isn't a drum roll here, but you can picture that in your head for each one of these if you want. If you really want to get creative, you can picture David Letterman's band behind playing really cheesy, weird music and making really corny jokes. I definitely have some dad jokes, so I might throw one of those in here or there, but you feel free to make up your own too. Put those in the chat, actually, if you have a good dad joke. I'm happy to steal it. So number 10. America is stressed, really stressed. One of the things you may or may not know is that the American Psychological Association, we're the group that puts together what's called the Stress in America survey. And so what we've been doing is we have really been working over several years to develop this systematic way of evaluating the general level of stress that America has, as well as individual components that have made people stressed. And so I'm going to go through a couple of those here in a little bit too, but let's start out with the general impression. So the general impression is that in our survey at the end of 2020 is that the average rating for people's stress was about 5.6 out of 10. So that is significantly above the middle, and it's actually a lot higher than we were seeing earlier in the year last year too. So compared with like last year in April or May, like when the pandemic first started, the numbers were pretty high, 5.4. And then as we went through the pandemic and got into August last year, they dropped, went down to 5.0. And now at the beginning of the year, it's a little surprising actually, is that at the beginning of 2021, the end of 2020, the beginning of 2021, January, we're seeing a very significant kick up in stress. Now, those seem like small blips, like only 0.2 increase. But when you look at tens of thousands of people, those kind of numbers really indicate some significant movement towards increasing levels of stress. So I wanted to frame this out first and just explain overall what we're seeing. Frankly, I would have expected in the heart of the pandemic, like the biggest part of the crisis, people to be the most stressed. That's actually not what we're seeing. It's really the what we've been calling the second pandemic, or if you think about racism, that some people have talked about as being the second one, the mental health pandemic or mental health crisis is really the third one, which is a very significant set of details, like I mentioned before, that are causing people to be even more stressed as they think about what does the future look like. On each of these slides, you'll also see, I will make sure the slides are available to you. There's actually a link for you to find additional information, including specifically about the mental health crisis that we believe that we're emerging into, and even more data about the Stress in America survey. Now, one of the details that has added to the stress is it's not just stress and it's not just mental health. But what we know is that Americans' physical health has also taken a back seat. So people had to basically buckle down or pull themselves up by their bootstraps and just try to get through on their mental health side. They did the exact same thing on the physical health side. The data showed that about half of all people delayed or canceled healthcare services, like physical health services. Some of that was because they had to, like some of the services like hand surgery, which is not considered essential, were all canceled during the early days of the pandemic. But this isn't even about what medical centers were doing. This is about what Americans chose to do. So people chose not to go to the doctor, not to get checked out. And so we're in fact seeing a bit of a tick up where people are developing some diagnoses now that they're going to get checked out that perhaps we could have caught a little bit earlier. Even at least as significant is the statistic on the right, which is showing that 53%, more than half, have been less physically active. So rather than taking objectively, we all know we had an opportunity to go out. If we weren't commuting as much, or even folks who lost their jobs or anything else, that's an awful way to think about it, forgive me, but if you have more time, people objectively have more ability to go exercise, to do more stuff, to learn more skills, to take piano lessons or whatever you were doing. In fact, I don't know about you, but on social media early on last year, I saw a lot of people pressuring other people to say, like, you should learn a new language and go play the piano, and you should be running a marathon by the time this is done. And goodness, that was just so frustrating because it was just putting so much pressure on people. We're like, man, people are just trying to like get through and just survive from day to day in a lot of ways. And you have these other people telling them to like go learn new skills when folks were just trying to keep their job or try to help their relatives or help themselves if they had lost their job or they were losing loved ones. So I think all of that stress led to people not getting their routine care as much and probably not exercising as much. And one of the things we know is that physical health and mental health are very, very much linked. So if your physical health isn't going so well, your mental health is very much connected to that. And so we really want to pay attention when you see trends on the physical health side. You frequently see the mental health trends often follow behind on those a little while later. And that's what we're seeing here too. Number 9. Essential workers. If the general population is stressed, the essential workers are super stressed. This has been one of the the COVID pandemic has been one of the most difficult times that as a licensed psychologist, I have ever seen my physician and nursing and psychologist colleagues, a whole range of health professionals, physical therapists, social workers, all of them, including people who just worked in the hospital who were not healthcare providers, folks who were manning the cafeteria, people who were doing maintenance work, et cetera, et cetera. This has been, and that's just on the healthcare side. That doesn't count all of the other sectors of the economy that were considered essential workers. Teachers, one of the biggest ones that come to my mind also. This has been such a significant period of stress. Many of them have been just like the general population, but amped up on steroids. Significant pressure on their jobs, to be exposed to folks who may or may not have COVID, to have their family and their school, their kids' schooling shift around. And so all the data suggests that there's a big uptick in the number of mental health concerns that group has had. You can see the data from our Stress in America survey here that shows that 1 in 4 essential workers have been diagnosed with a mental health disorder since the start of the pandemic. That is a very, very high number. That's a bunch of people. You think about that. That's 1 in 4. Let me make sure you get it. That's 1 in 4 essential workers were diagnosed with a disorder since the start of the pandemic. That's not counting all the people who may or may not have had some mental health concerns beforehand. That's just since this pandemic started. That's how much pressure this whole thing has added to folks. And as part of this, let me add one more piece, which is one of the difficulties with mental health overall is that there is still, boy do I wish this wasn't true, but it is, there's still this very significant stigma about mental health. People feel embarrassed, not all people, but a lot of people still feel embarrassed, or like that's part of their private business, that they don't want to share with other people in a very different way than for like physical health conditions a lot of times. So one of the things that happens is that all of the things that went into the pandemic have caused 25% of our essential workforce in this country to have a potentially diagnosable mental health condition. And what's happening at the same time is that a lot of times people feel like they have to put their nose to the grindstone and just keep plowing through, and we don't have enough access to care, and people still feel, because of this stigma, embarrassed. And a lot of industries are not very mental health focused. They're not very progressive in terms of understanding why that's such an important issue. And so a lot of these folks just simply couldn't get access to treatment. About 34% of folks access treatment. So that's a very, very low number. So you've got a whole group of people, about 25% of all essential workers have a mental health condition that have emerged in the last year and a half. And only about a third were able to, in fact, move forward with getting some help. That is an absolute crisis level kind of problem. When you think about the workforce in the United States and having people who are healthy do our jobs, be able to work in communities and families and jobs, and be able to keep things moving, especially when there's so much volatility, having people who have these kind of mental health concerns not be able to get care, either because of stigma or lack of access, etc., that's a really gigantic problem that we need to fix. So again, that's trend number 9, is if the country itself is stressed, essential workers are super stressed and are not able to get the kind of care they need. So we, as insurance executives, as healthcare workers in that sector, really need to think about some nimble and some creative and frankly urgent solutions to figure out how can we continue to support them, and not just continue, but what can we do to amp that up in a really important way. That's going to be a big deal. Number 8, if all of the details I have shared so far has not added to point number 8, I don't know what will, which is that there's been so much stress that, not surprisingly, there are a whole number of emerging concerns about people having gained weight. So many of us stress eat. It's either stress eat or stress drink, that it has really caused a whole bunch of us. In fact, it's the majority of American adults, 61%, who reported experiencing undesired weight changes since the start of the pandemic. That's a bunch of us. And in fact, more than 2 in 5 people, so about 40%, say they gained more weight than they wanted. And of that group, the average was 29 pounds. So of the folks who gained in weight, because there's some folks who don't eat as a way to manage stress, but of the people who gained weight, the average was 29 pounds. It's a very significant amount of weight. Now, on the mental health side, it's perfectly understandable if you think that people tend to eat. It's across multiple different cultures that people tend to eat in a lot of ways, both to relate to each other, to connect. So I think some of this is probably, if you were missing the personal connection, sitting down for a big meal is very common in a lot of families and cultures. And if you were missing that and not being able to go over to your families to do it, you might have tried to kind of recreate that, whether it was implicit or explicit, to just kind of create the feelings that go along with having a meal, or even try to do Zoom meetings, or frankly, it could just be, there's a lot of biological research showing that when you eat, your energy in your body gets focused on your stomach. So there's actually not enough energy left for you to focus on feeling stressed. So it's really a biological way to manage your emotions and to regulate your emotions in some ways. So whatever the reasons, there's a lot more, but whatever the reasons all are, I'm including maybe just buying more unhealthy foods. People have gained a very significant amount of weight. And so that's one of the trends we have to pay attention to. And so when we think about what kind of services are we going to need to offer, what kind of conversations are businesses and customers going to be having, one of the things that we're going to be needing to think about for this coming year and emerging year is how do we get people back into more active ways of taking care of themselves? What can we do to support people having active lifestyles, developing evidence-based ways of controlling the kinds of foods they're eating, controlling their caloric intake, being able to do this again in not in a fad dieting kind of way, but really using evidence-based kinds of methods. What comes up for me when I think about this, and what some of the emerging literature is showing, is part of the problem has also been, if your job is like mine, just like I'm doing right now when I'm talking to you on this camera. I'm not sitting with you in a room where we can get up and take a break and you have a handshake, get a coffee, walk outside, walk around the building. I'm sitting in front of this camera talking to all of you. And when we do this presentation live, you will be listening to this video recording of me doing this. So we're all sitting in front of these computers so much of the day that we have to force ourselves to get up and take a break. And again, if you're anything like me in my work, there's been so much pressure to make sure we're doing the right thing and moving forward and showing impact and value, that the meetings, we can put down on paper all you want that the meetings are going to be 45 minutes. It's really hard to stop the meeting at 45 minutes instead of going the whole hour. And so in our business, we have really tried to, in the APA, tried to make that adjustment. That's just one simple thing, but it's really hard to do. So there's really no surprise when you think about people struggling with weight. It's just the way the whole business environment is being conducted in a lot of ways these days is through computers, which just forces us to be more sedentary. So we really need to think. So when we think about next steps, we need to think about how do we change it. It's frankly behavioral science. How do we change people's behavior so that we're not shaming people or getting after them in inappropriate ways, but providing evidence-based resources, evidence-based treatments, technological opportunities. How can we change the way we're doing work? How can we do phone calls or Zoom meetings where we all go take a walk in our neighborhood together, or something like that where we can be more flexible? So I think there's a lot of ways we can really think about how to move forward. But the weight issues and people's body image, their productivity at work, that's one of the most emerging trends also. If you'd like to look at this data, this gives a really significant breakdown about, depending on which category you're in. So all US adults versus breaking it out by gender and breaking it out by generation and by different ethnic group also. So I'm not going to take time to go through all that, but I wanted to make sure that you had the opportunity to see this information. And I would, in fact, because you can see some differences actually between different groups, there might be more targeted ways of doing interventions with different people groups as well. And so that's going to be really important when we think about developing evidence-based methods to help move forward to manage the weight concerns that have emerged in the last year. Next, number 7. One of the things that's really coming up in an important way is figuring out how to heal the political divide. What you'll see from our data here is that there has been a very significant amount of stress, and frankly, this has been going on for a number of years. It's in fact, you can see on the screen, it's 81% of Americans believe that the future of the nation, so when they think about what does it look like to be an American, what does the future of the country look like, that thought, that's 4 out of 5 people, think of that as a very significant source of stress. That's very upsetting. That has very little to do with what side of the political aisle you're on, by the way. So it doesn't matter whether you are politically red, politically blue, whether you're purple, whether you hate politics and don't want anything to do with any of this or any place else. Very much a concern. And interestingly enough, when you compare that amount of stress, so when you think about politics, 81% say that politics and the future of the nation is a source of stress. That's actually a tick higher than people who cited the coronavirus as a source of stress. So 81% said the future of the nation, and 80% of people said the coronavirus. So that's remarkable that the political stress is just as high or higher than the coronavirus this last year. Um, and specifically, 74% cited political unrest, not just the politics and the future of the nation, but the divide, the unrest, the difficulty feeling like if you're a CNN or an MSNBC watcher, and your relatives are Fox News watchers or the other way around, how do you have those conversations? Just being stereotypical about the different media outlets here, how do you have those conversations to really bridge the gap between really different ways of looking at the world and different ways of looking at the future? Now, I'm really glad to say this is not just all a negative trend here. There is actually a very significant element from this data too, which is that 90%, so even more than people concerned with either COVID or the future of the nation or political unrest, 90% hope that the United States moves more towards unity. So it is not like people have given up. It's not like people are sitting around thinking, my word, we're just all doomed or something like that. There's actually a significant number of people that have a very significant amount of hope that we can find better ways to move forward together. And this is across party lines. You can see I have the data here on the slide. It's actually 92% of Democrats, 91% of Republicans, and 88% of independents hold that view. When you look at the statistics, those percentages are just very, very much within the margin of error. And so it's basically everybody, again, around 90%, who really still holds out some hope in terms of being able to move forward in a productive way, which is very, very important. And I think we need to really hold on to that part of it, while also thinking about the work we're doing, whether it's from my perspective and thinking about how to help psychologists benefit the communities they serve, or your work thinking about working with your customers and trying to provide health services to them. How do we really think about that political element and just the stressful pieces that have gone on? What would that mean? Now, 6. This is a really heavy topic and a really, really important one. So I want to take a minute and talk about the racial awakening and the injustice that has been, well, it's frankly been in our country for a long time. So I want to talk about that theme and that trend. And I want to talk about DEI, diversity, equity, inclusion, for a few minutes. So let me just start by highlighting that the deaths of George Floyd and Breonna Taylor, Ahmaud Arbery, and other Black, Indigenous people of color are what part of our APA president has referred to as a racism pandemic. And on a personal note, as the father of 3 Black girls, I have personally felt saddened and troubled and angered, not only by the events of this past year, but frankly by the generations of injustice and unequal treatment and health inequities experienced by people of color. It's just not okay. And some of us, as people and professionals, have been coping with our own past experiences of racism or injustice, while also managing current experiences, whether they're overt aggression or microaggressions, and a lack of support. Several colleagues that I have talked about the work, especially in healthcare settings, as being heavier right now. I'm sure that extends outside the healthcare settings too. The work can be draining. And at the same time, because I'd like to think of this as an awakening, it may be some of the most important work that we have done as a country, maybe ever, and certainly for a very long time. And I want to say that it's very clear in my mind, and I hope you'll join me in this, that we need to do more efforts for diversity, equity, inclusion, DEI. Black and brown people are precious and their lives matter. And it's time to give a space and a voice to those whose voices have been silenced or quieted. And that's part of the coming together that I think we all need to do. We need to come together more than ever to achieve the vision of equality and equity, health equity for all in this country. When we think about healthcare, we think about science that backs that up, and we think about being able to work when we look at health plans and providing insurance coverage. There's a whole range of things we can consider. At the bottom of the screen here, I've actually tagged a Forbes article where there was some consideration among insurance regulators about how to really address racism and discrimination. And when you look at the work that we do in that space, it's very important to consider policy and how does policy, is policy not just not racist, not sexist, but are we writing it in a way to make it anti-racist or anti-sexist, meaning that we're actively striving to be inclusive and equitable for a whole range of people, especially keeping in mind people who have historically been marginalized. Let me give you an example that we don't often think of in this conversation too, which is disabled folks. There's a whole range of health services that are very difficult for disabled people, particularly during the pandemic, to have accessed. And so we really need to think about, as we should have been thinking about this the whole time, but we very much need to think about as employers, as we work together to provide care, that we don't ignore people, again, who have been marginalized and whose needs require a little extra attention and a little extra focus to make sure that we can get the right information, the right services to them at the right time, so that everyone's health can all move forward in a positive direction together. Now, this is a little bit of information specifically about Black adults and their concerns about the future. So I wanted to tie the last two items together. When you look at white adults versus Black adults, there are some differences. And so I wanted to take just a minute and highlight that Black folks, Black adults, how they feel. What you'll notice, it isn't just Black folks. We actually have a couple of broken out different ethnic groups, including Hispanic folks, Asian folks, and white folks. The reason we're highlighting Black adults is that they're the most likely to report concerns about the future. And so this is just a data-driven indication that this last year and the racism that has been going on for far too long, and frankly, the inequities that COVID has brought to the surface, have impacted that group even more than other groups. Now, moving towards a couple of additional trends. Number 5, mental health apps are on the rise. I'm sure this is not news to you. In fact, to the best of our understanding, this is a huge range because it's impressively difficult to measure this. There are probably between 10,000 and 20,000 mental health apps that are available. That's through your phones, that's through the computer. They're all over the place. And it's very difficult to measure that because some of them are very overt that they're trying to manage depression or improve your stress. And some of them are a little bit more subtle and they don't really look like a mental health app, even though there is some element of that there. Now, what we've learned by doing some additional research is there was some original concern that when the mental health apps started proliferating, especially by the mental health community, as you might imagine, that apps were going to start dominating the space and we were going to have all of this pop psychology. And if you don't mind me just sort of like making this it isn't terribly funny, but just making a joke about it for a second, the concerns were that like people were going to be doing like bonkers things, like rubbing crystals on their head or doing like forgive me for making that joke, but just like weird stuff that has no evidence base whatsoever. Like there's energy therapies out there that talk about like aligning your energy and this kind of stuff, and like that has no evidence base whatsoever. Nor does the crystal stuff in general. People were worried that apps that kind of push this pseudoscience way of approaching things were just going to proliferate, and they were going to, in fact, drive people to believe that the population to believe they were getting mental health treatment when, in fact, they were not. In fact, maybe they were getting something that seemed like mental health treatment, but it was really wonky, and maybe even could cause some harm. I'm sure there are instances of that. However, what the actual trend shows is that apps are often leading people to get actual evidence-based care more often than not. So when people get into an app, they start becoming more aware of the kinds of things that they need to manage, that the issues that might be coming up for them, and that actually leads them, especially frankly, a lot of apps are really good at saying, go see a mental health practitioner. There's a lot of legal coverage, of course, by saying, this app doesn't actually provide legal medical care or mental health care. You need to go see a professional for that. So to protect themselves, a lot of them say that kind of thing. And frankly, that has driven people to go get evidence-based therapy as well. And let's be honest, there is a good bit of benefit. There are actually some apps that are very, very significant. Just to keep this at the general level, I'm not going to name any of them, but a number of them have, in fact, donated services to essential workers and to healthcare providers as a way to help people center themselves, calm themselves, meditate, just take a moment to be able to reduce their stress, etc. So there's genuinely a benefit to reducing the stress of the general population. And in some way, what I would hope is that, I don't have data for this, but I really think that there's been some indication that by having that available, it provides an opportunity for prevention. So if even just a person feeling like they're trying to do something to help their circumstances, to help their mental health, just you reaching out, your effort as a person, even if it's just an app and something simple, that's frankly what a lot of the placebo effect is based on, is somebody doing something to reach out to try to get some help by itself has a very powerful effect. And just not feeling or being helpless, but in fact moving forward and trying to do something. So I think there's that effort, that prevention focus really has helped people move forward. Now, to be fair, it's not all rosy. There are some very significant and very real concerns about app quality and the lack of regulatory oversight of them. It's just a wide open marketplace, and there is, for every app that you find that is really decent and has some science behind it, there's another one that is just pseudoscience or garbage, and it's not helpful. It's like some talk show host dishing out advice that they should not have ever dished out, or frankly, some connection between political advice and mental health advice and personal things that they got from people when they were growing up, which is just often gobbledygook more than it is really helpful. So there's good and there's bad about mental health apps, but those are definitely on the rise, and we need to keep that in mind. 4, the next wave, digital therapeutics have emerged. I hope that you have heard about this trend. So if one of the concerns about apps overall is that they are not regulated, the digital therapeutics space seeks to solve that. So digital therapeutics, in case folks have not yet heard of that, those are regulated and digitized health services, software, and applications. You can see this is a little bit of an academic definition here. Software and applications that are very specifically trying to treat a certain disease or a disorder. There's some of them, for example, I'm aware of one that I've talked about in my previous job at a large medical center that was had very good data supporting the treatment of panic disorder through the use of breathing treatments. There are some that work on treating sleep disorders. There are actually several that have worked in that have been developed in the substance use and substance disorder space, which is still a really important thing to pay attention to, because while that did not make the top 10 of my list in terms of trends, what I would reach out and offer an honorable mention, that's a terrible title for this, but I think you'll get the idea, is maybe trend number 11 would be that the opiate crisis has absolutely not gone away. In fact, all of the data show that the opiate crisis has in fact gotten worse during the pandemic, not better. So we really need to think about, how do we reach more people? We cannot create enough practitioners on the health side or the mental health side to solve the health and mental health issues in this country. We simply can't. We need to be more efficient and figure out what the efficiencies are. And one of the ways to do that is to be more efficient just in a similar way that the business world has, which is to look at, what is the right place for a doctor to work in? What's the right place for a master's practitioner to work in? What kinds of entities and applications like digital therapeutics can be prescribed that don't take as much human time, that don't take as much human resource or human capital, but in fact could be run by a doctor to make sure, because to be fair, if you're using a breathing treatment to regulate panic disorder, if you misregulate or dysregulate someone's breathing, that can really cause significant problems and significant harm. So we really need doctors to be able to oversee the use of these digital therapeutics. And so we're really moving forward on the psychology end with looking at psychologists, psychiatrists, and other physicians prescribing these, and then having them overseen, likely in some ways by master's practitioners, because we want to make sure that there's still a human element and human leadership in this, to make sure that both they're equitable, that they're ethical, and that they're scientific, and that they're applied in a rigorous and an appropriate way. So there's some very, very important new emerging work in this area. And in fact, just to highlight a couple more points, some of the digital therapeutics are designed very specifically to work in conjunction with treatments that already exist, that are already established. Some of the digital therapeutics are a little more bold, and they actually are hoping to disrupt the system and disrupt the industry. And frankly, if we can provide more access to care in an evidence-based, culturally sensitive way that still has the human element, where we have leaders set up, that's going to be very, very important. And so I am very much looking forward to seeing how that's going to emerge. Just so you know, the FDA, the Food and Drug Administration, is overseeing this on a regulatory level. And so in case you have trouble falling asleep some night and you really want to lean into the regulations, you can look up, I have the link here for you, which you'll be able to see on the slides. It's actually really good information. It isn't just a snoozer, but it'll help you catch up on some of that in all of your spare time. Let's go through the last three. Trend number 3, interstate practice. One of the things we're seeing during the pandemic is, with so much virtual work, especially in the mental health world, is that we've figured out that psychotherapy, and in some ways psychological assessments, can be delivered through telehealth. That's really, really important. And on the physical health side, there's a growing trend to thinking about doing digital appointments. That had already been growing, and the mental health side had been more emerging. What I think we've seen in the last year is not that we're in a different place today than we were ever going to be. I think we have just gotten there 10 years earlier. I don't think it really changed the trajectory. I think it just escalated it by about a decade. So what we're seeing is more of a demand for interstate practice, frankly, because people are more mobile. They can connect with each other, and they can connect with their jobs, and they can connect with their health services in a much more facile way through the computer, especially for routine care, than they ever could before. Now, on the psychology side, if you don't mind me bragging about our profession for just a moment, we're probably the most advanced in regards to interstate practice. We have what's called the PSI-Pact, the Psychology Interjurisdictional Compact, which is a piece of legislation that when state legislatures sign it, of course the governor has to sign it, but it allows interstate practice for telehealth between all the states. And let me tell you in quick order why that's really important for mental health specifically. Back to the idea of trying to provide efficient care. What we want to do is be able to develop a network of providers so that the population can get access to the kind of care they need when they need it. It's very difficult these days to find care and find access to care in an urgent way unless you're truly in a crisis. It's very hard to find care without having to wait weeks or months. That's especially true for specialty, like truly unique specialty areas. I'll give you the example that I frequently use, which is it's very hard to find an eating disorder specialist. That's a very unique specialty that doctors tend to focus on because there's a very significant overlay between medical health and mental health around eating disorders. Very hard to find a specialist, especially if you live out in the country, if you live in the frontier, very hard to find. That's true for serious mental illness. It's true for a whole range of specialty conditions. And so what we want to do is be able to open up state licensing in this specific way to make sure the public is taken care of, but to do it in a way that the public can find access to people who have clinics that are specialized to at least get a diagnosis, if not high-level care. If your state or your region doesn't offer it, we need to be able to provide that in a different way. And so we're really opening this up. So I would encourage you, if you haven't looked into this, it's one of the reasons, again, I think that psychology has been leading across the country in this kind of effort. And that it blends right into number 2 on the trends, which is that telehealth and phone-only services are absolutely here to stay. The research shows that telemental health works. It, in fact, is at least as effective as in-person therapy. There doesn't seem to be much of a trend showing any differences between in-person therapy or not. People who are saying that they need to come in the office in person, it's probably more of an issue of comfort and just general usability and frankly, what you're used to more than it is the actual science. And what you'll see actually during the pandemic with a little bit of data below is that about 75% of mental health clinicians said that they are only treating patients remotely during the pandemic. 61% are providing phone-only services. And I want to take just a second to highlight that while we think about telehealth and we want to push telehealth access, telehealth, by the way, means video conferencing. That's like the regulatory definition of it. It means video conferencing. Phone-only services are an absolutely crucial addition to that. It's not just an addition, they have to be linked together because there are still a number of people, especially marginalized groups and people who don't have access to the video chat. They don't have access to broadband. They don't have access to computers that are technologically capable of really running a good video chat. For example, older folks in nursing homes, really, really important example. Or people who live out on the frontier who, again, don't have the high-level Wi-Fi. So we really have to be able to have phone-only services on the mental health side specifically to provide actual psychotherapy treatment. And again, the link at the bottom goes over some of that data if you'd like to see it. The phone-only psychotherapy research, it shows just as good outcomes by doing phone-only treatment as just as in person. It might not seem like just talking to somebody on the phone works, but really what happens, just on my own experience, if you can imagine talking to somebody on the phone, you're not paying attention as much to the other person's body language and other kinds of things. You're listening to the information they're providing to you. It allows you to really digest, like if the therapist questions something or asks them to think about something in a new way, or how are they feeling about something, it really pushes the patient to really reflect on that and do it in a way that's helpful. So I want to make sure when you're thinking about reaching your customers that you're really thinking about providing accessibility. And I'll add one more business point, and I'm going to get to the last one, and then we're going to stop. From a business perspective, one of the things when we partnered with our new employee assistance program is that I'm the chief of professional practice for the APA. It means I'm responsible for the 110,000 licensed psychologists in the country in terms of strategy and moving the profession forward. And for our workforce, we have about 500 employees, and for our workforce, I insisted that we have an EAP that provided telehealth services. That was even before the pandemic. And part of the reason was a business one, which if you think about somebody doing a job, especially if you're in person, to do a service, they have to go out of their office, take the train or take their car, go across town, see the person for a physical health or a mental health service, get back on the train, get back to the office, and then restart their work. So not only is the person not focused for a little while, probably while they're getting prepared for the session, you have to drive across town or train across town, come back, et cetera, et cetera. If you have a telehealth session, even if you lose a little bit of time from a work productivity perspective on either side, just getting ready for the session, there is no travel associated with it at all. And in fact, as long as they have an office space, it's very private, it actually is a much more efficient way from a work productivity perspective to be able to deliver and get access to care. Because let's be honest, even if you go to a medical or a mental health appointment, it's not like those 2 or 3 hours that you have lost. It's not like that work actually goes away. You just have to do it at the end of the day, or you have to move your schedule around for the week. That's how most of our work goes. I wish that wasn't true, but that's just the reality of it. So I want to really encourage you to think about, when you're working with your customers, to think about making sure that you prioritize telehealth and phone-only services to reach those marginalized peoples, to make sure that you can continue to even describe this as a value add for your customers going forward. And lastly, the number one trend, I would not be a psychologist worth my salt if I didn't take a second and tell you personally that you matter. This has been, again, a very hard year. I've shared a very personal thing about losing my dad, thinking about the health equity and the racism and injustice issues. This has been a struggle on some personal notes for me, and I know it has for you too. And everyone has a different experience, but what I want to say as a way to wind this up is you need to remember to take care of yourself, remember to take care of your family, and take care of your community. You are worth taking time out of your work day to go on the walk. You are worth taking some time to plan to eat healthy. You're worth taking time to figure out how to connect with other people. You're worth asking your boss for a reduction in your workload because it's too much. You're worth managing the burnout and the stress, the overeating that you may have done like most of us. So that's the note I want to end with, is not just we need to think about mental health trends overall, but at some point we need to think about us as individuals, not just systems, not just managing customers and thinking about it in terms of thousands or tens or hundreds of thousands of people, but we need to take this back in some ways. If we really want to lead, we need to take this back to the personal level and say, how am I helping? How am I taking care of myself? How am I helping my neighbor? How am I really benefiting my community in a personal way? And a lot of ways that starts with making sure you're taking care of your own health. So I hope that we've had a chance to discuss during this talk all of these points and maybe more. I would very much love to have an opportunity to we'll provide the slides to you. Would certainly be happy to reach out and have another conversation with you if you'd like to do that. Thank you so very much, and wish you all the very best on a personal, professional note. And thank you again for the opportunity to speak with you today.